earlier speakers mainly focused, in my understanding, on the gaps in the biological weapon convention or the implementation mechanism with regards to 1540. My focus is more on what measures have been taken with regards to meeting our obligations under the biological weapon convention. Well, it depends on the paradigm that one is using, whether you are looking at the gaps or be slightly on the optimistic side and see what all we have done so far over the years to meet our obligations. So my focus is inclined towards the more on the optimistic side. And like the earlier speakers, of course, whatever I'm going to say is based on my own experience and my personal views. You will also see a lot of repetition that is going to emerge, but I hope you will bear with me. I will try to give it a different touch, but there will be certain repetitions. Mainly, I'll focus on the biological weapon convention, the important articles. What actually BWC requires from the state parties are, in other words, what are the obligations? What is the national implementation mechanism of BWC in Pakistan? Then I'll move on to Pakistan's strategic export control regime. I'll talk about the control list and also some of the important biological agents and toxins that are mentioned in the control lists. Implementation challenges from the regulator's perspective, and at the end I'll give some recommendations on how can we move forward and further strengthen implementation mechanism in the country. Now, in my view, there are 7 articles which are important in the BWC, and as you would know that BWC has a total of 15 articles. Article 1 is the most important because it defines the scope of the convention, which applies to all scientific and technological developments in life science. Again, then there is Article 3, which calls for appropriate measures to be taken that includes effective export controls and other measures. Article 4, again very important, it asks the state parties for national implementation measures to ensure safety, security of biological agents and facilities. Article 7 is about providing assistance to the states which have been exposed to biological threats in violation of BWC. Article 8 supplements the Geneva Protocol. Similarly, Article 9, it lays down strong basis for negotiating CWC, which was then negotiated and adopted in 1997. Article 10, again, is very important, and in terms of the developing countries, it has special importance because the developing countries mostly are interested in exchange of technological information, education, and assistance in terms of equipment. Now, looking at the various provisions of BWC, let's see what actually BWC requires from the state parties. Number 1, the states are required to have appropriate measures, including effective export controls. They are required to ensure safety, security of microbial and other biological agents or toxins in laboratories, facilities, and during transportation. Also, the states are required to promote awareness among the relevant professionals in the private as well as public sector, promote the development of training and education programs, for those granted access to biological agents and toxins, promotion of a culture of responsibility. Again, it is linked with the next point, and that is promulgation of codes of conduct for the life scientists or use of biology for useful purposes. Then strengthen methods and capacities for surveillance and detection of outbreak of diseases at the national, regional, and international levels. And in this context, international health regulations of 2005 are important for building capacity to prevent, protect against, control, and respond to the spread of diseases. States are also required to take necessary measures to prevent anyone from developing, producing, stockpiling, or otherwise acquiring, retaining, transporting, or using. So this is a connotation that was given in the 6th Review Conference of the State Parties, that this convention applies to all these areas, which is acquiring, retaining, transporting, or using biological agents, toxins, and equipment for development of biological weapons. As you have heard since morning many times, that Pakistan signed BWC in 72 and ratified it in 1974 as a non-possessor state. Various measures that Pakistan have taken over the years to comply with the various articles of BWC include legislative, regulatory, and administrative measures, and I'm going to talk about some of the acts and ordinances, other legislative pieces, introduction of biosafety and biosecurity measures, strengthening export controls, and submitting comprehensive reports to the United Nations Security Council Resolution 1514 Committee. Also, as required under the BWC, a focal point in the Ministry of Foreign Affairs has been designated, notification of biosafety rules of 2005, and Pakistan is also part of the global health security agenda. National biosafety and biosecurity policy has also been issued, which covers biomedical laboratories in order to ensure that they have reliable and safe laboratory capacity in place. Then there are disease surveillance and response units located all over the country. On the legislative side, there is Pakistan Penal Code, which penalizes those who are involved in acts likely to spread dangerous diseases. Section 270 makes it an offense to spread infection which is dangerous to life and is punishable up to 2 years in prison and also fine. Also, there is Defense of Pakistan Ordinance of 1965, which prohibits and regulates the possession, use, or disposal of dangerous substances. Drugs Act 1976 talks about export, import, manufacture, or sale of any spurious or unregistered drugs. There is Quarantine Act of 1976, which provides for a mechanism to control transport of material that can be used in biological weapons. Animal Quarantine Act of 1979 has been promulgated to regulate import, export, and quarantine of animals and animal products in order to prevent the introduction or spread of diseases. Again, there is Surrender of Illicit Arms Act of 1991, which defines illicit arms as including poisonous or noxious gases or other chemicals. Terrorism Act has been dilated earlier. Also, it penalizes individuals in possession of illicit weapons that may include chemical and biological weapons. It also prohibits aiding and abetting others to acquire biological weapons, and also prohibits financing of the proscribed activities. Environmental Protection Act of 1997. It prohibits the generation, collection, consignment, transport, treatment, disposal of, storing, handling, importing of hazardous substances. And then there is Strategic Export Control Division and Strategic Export Control Act, which was promulgated in 2004. This act enables the government to control export, re-export, transit, and transshipment of nuclear and biological weapons-related material and their delivery systems. Biosafety rules again provides guidelines on how biology has to be used for peaceful purposes. On the strategic export control regime, as I said, that there is Export Control Act 2004, then there are control lists. Strategic Export Control Division was set up in the Ministry of Foreign Affairs. There is an oversight board. Export control, licensing and enforcement rules were notified in 2009, which provide a comprehensive set of procedures on how licensing of controlled commodities are items which are listed in the control lists have to be permitted or denied in case there is application for license. And then policy guidelines on strategic export control were issued in 2016. The control lists that were issued pursuant to Export Control Act 2004 actually lists down different biological agents as shown here on the slide, and the different control list classification numbering system. The next slide would show certain important biological agents and toxins that are mentioned in control lists. So the point here is that all these viruses, bacteria, or fungi are subject to licensing if they are mentioned in the control lists. And that is primarily for the reason that if there is any transfer, that should be for peaceful purposes only. On the implementation challenges, as all of you are aware that rapid pace of scientific and technological development has created new threats, as well as there are opportunities for cooperation. Verification challenge is there due to the dual use nature of cutting edge emerging technologies. Then there is no organization at the national level like the NACWC, which is the National Authority on Chemical Weapons Convention. There is only that focal point, as I earlier mentioned. Then there is lack of coordination between governmental institutions and other relevant stakeholders on matters of bioethics, biosecurity, and biosafety. Lack of awareness in the general public, researchers, academia, and industry. Existing regulatory setups, in fact, it appears to be dormant, and I have practical examples where even the researchers researching on some of the viruses are not aware that they had to or they are required to seek permission from the National Biosafety Committee or institutional biosafety committees. Researchers are not aware about the procedures for export of biological material for research diagnostic purposes to international reference laboratories, and again this point is linked to the point that I earlier mentioned. And there is lack of regulatory oversight on the export of human biological material, although certain guidelines have been issued, but there is no legal piece of paper that puts mandatory requirement on how this aspect has to be regulated. So this is my last slide. The way forward, most credible and sustainable method of strengthening the BWC. This is at the international level is through multilateral negotiations towards a legally binding protocol, including the verification provision, dealing with all the articles of the convention in a balanced and non-discriminatory manner. And that would include Article 7 and the connotation of Article 10 as well. Sensitization of the academia, researchers, business community, and civil society is necessary to apprise on safety, security, and the risks that are involved in handling biological agents. Capacity building of academia and scientific community on research publications, code of ethics and conduct in biosafety and biosecurity. Also, I think that there has to be some setups that could be within the existing think tanks or a dedicated think tank to carry out research in this area and suggest policy recommendations for the government. Adoption of internal compliance program. Comprehensive guidelines have been issued by Strategic Export Control Division and also with Dr. Javed Khurshid and other renowned experts have had different sessions jointly with HEC to raise awareness in the academia and in the research community. But that process needs to be carried forward so that there is adequate awareness. Then also at the postgraduate level, there is a need that some courses are introduced for the students of science and engineering, which may cover all aspects of internal compliance and the risks that are involved with dual use research, strategic export control, biosafety, and covering biosecurity aspects as well. I thank you very much and would be pleased to try to answer if there is any question. Thank you very much.